Hi everyone. In this video, we are going to learn about range of motion exercise. I am Jenlyn Bernard, working as senior tutor in MMM College of Nursing. This video will be helpful to you to understand and learn about the definition of range of motion exercise, different types, and also the different range of motion according to the different joints in our body, and also how to provide the passive range of motion exercise. Range of motion is the measurement of movement around a specific joint or a body part. The range of motion exercise can be classified into three. That is passive range of motion exercise, active assistive range of motion exercise, and the third one is active range of motion exercise. Now we can see one by one. Passive range of motion exercise is typically practiced on a joint that is inactive. The nurse or a therapist may use this exercise on a client who is paralyzed or unable to mobilize a specific joint. This type of exercise can help prevent stiffness from occurring. During this exercise, the patient does not perform any movement while the therapist stretches the patient's soft tissues. Active assistive range of motion exercises are more progressive, intended for the client to perform movement around the joint with some manual assistance from the therapist or from a strap or band. These exercises can often feel painful and the muscles can feel weak. Increasing range of motion with these exercises should be a gradual advancement. Active range of motion exercises are highly independent, performed slowly by the client. The therapist's role may be simply to provide verbal cues. The pivotal type of joint is present in the neck. The possible movements are flexion, that is bringing the chin to rest on the chest. Then extension, this movement keeps head in erect position. Hyperextension, that is bending the head backward as far as possible. Then lateral flexion, that is tilting the head as far as possible towards each side of shoulders. It may be a left or right side. The shoulder is made up of ball and socket joint. With this, we can able to perform flexion, that is raising the arm from side position forward to position the arms above head. Extension, that is returning the arms at position at sides of the body. Hyperextension, in this the arms will be moved behind the body, that is keeping the elbows straight. Internal or inward rotation, with elbow flexed, rotate shoulder by moving arm until thumb is turned inward and towards back. External or outward rotation, with elbow flexed, move arm until thumb is upward and lateral to head. Circumduction, in this movement the arm can be moved in full circle. It is the combination of all movements of ball and socket joint. Elbow is made up of hinge joint. The possible movement is flexion, that is bending elbow so that lower arm moves towards its shoulder joint and hand is level with shoulder. The extension of movement is straightening the elbow by lowering the hand. The type of joint present in the forearm is pivotal joint. With this, the possible movements are supination, that is turn lower arm and hand so that the palm is upwards. Pronation. It is just opposite to the supination. Turn lower arm and hand so that the palm is downwards. The wrist is made up of condyloid joint. The possible movements are flexion, extension and hyperextension. Flexion, that is move palm towards the inner aspect of forearm. In extension, move fingers and hand posterior to midline. Hyperextension can be done by bringing dorsal surface of hand backward as far as possible. The other movements of wrist are abduction and adduction. Abduction also can be called as radial deviation or ulnar flexion. It can be performed by bending the wrist laterally towards little finger. The abduction can be known as ulnar deviation or radial flexion. The movement can be performed by bending the wrist medially towards the thumb. The fingers are made with a combination of condyloid and hinge joint. The possible movements are flexion, extension and hyperextension. The flexion can be done by making the fist. Extension is straightening all the fingers. In hyperextension, bend fingers backward as far as possible. The other possible movements at fingers are abduction and adduction. In abduction, the fingers will be spread apart. By bringing the fingers together, we can perform adduction. The saddle joint is present in the thumb. The movements can be performed is flexion, that is moving the thumb across the palmar surface of hand. Extension, move thumb straight away from hand. Abduction, extend thumb laterally. Adduction, move thumb back towards hand. Apposition, it is the unique movement present in the thumb, that is touch thumb to each fingers of same hand. The hip also made up of ball and socket joint. The possible movements are flexion. It can be achieved by moving the leg forward and upward. Second one is extension, that is moving the leg back beside other leg. Third one is the hyperextension of hip joint. It can be achieved by moving a leg behind body. Fourth one is abduction. It can be achieved by moving a leg laterally away from the body. Fifth one is adduction. It can be done by moving a leg towards medial position and beyond if possible. Sixth movement is internal rotation, or it can be called as inward rotation. It will be performed by turning the foot and leg towards the other leg. Seventh one is external rotation or outward rotation. It can be performed by turning the foot and leg away from other leg. The last movement is the circumduction. In this, the leg can be moved in a circular manner. Hinge type of joint is present in the knee joint. The possible movements are flexion and extension. The flexion can be performed by bringing heel back towards back of the thighs. The extension is returning the leg to the floor. Dorsal flexion and plantar flexion is possible in the ankle joint. It is made up of hinge joint. Dorsal flexion can be possible by moving the foot so that toes are pointed upwards. By moving the foot so that toes are pointed downwards will be the plantar flexion. The foot is made up of bleeding joint and inversion and eversion movements are possible in that. Inversion can be performed by turning the sole of the feet medially. When we turn the sole of the feet laterally, it is called as eversion. Condyloid joints are present in the toes. Totally, there are 4 types of movements are possible in the toes. The first one is the flexion, can be achieved by curling the toes downwards. By keeping the toes straight, extension can be done. When we spread the toes apart, it is called as abduction. By bringing the toes together, we can achieve adduction. Trunk is made up of leading joint. The movements possible are flexion, that is bending the body towards front side. In extension, the body will be bent backward as far as possible. In the trunk, lateral flexion also possible. It can be bent towards its right or left side. Now we can see how to provide the passive range of motion exercise. Explain the procedure to patient, maintain proper body alignment, expose only the limb being exercised, support the limb above and below joint to avoid muscle strain or injury. Cupping joint or cradling limb technique can be used. In painful joint, support the muscle area above and below the joint. Use firm and comfortable grip while holding. Move body parts slowly, smoothly and rhythmically. Avoid moving body parts beyond the existing range of motion. If muscle spasticity occurs, stop temporarily. Apply slow, gentle pressure until muscle relaxes. Then proceed with range of motion exercise. If contracture present, apply slow, firm pressure to stretch the muscle fiber. If rigidity occurs, apply pressure against the rigidity and continue range of motion exercise slowly. Ensure patient is comfortable throughout the procedure. I have taken the reference from Fundamentals of Nursing textbooks and also from the internet. Thank you for watching.